What is vitamin K? Vitamin K is a family of structurally similar fat-soluble vitamins K1, 2, and 3. These are stored in the body's adipose tissue and liver. It's best known for and named after its role in coagulation. The three forms of vitamin K include vitamin K1, 2, and 3. K1, also called phyloquin, is primarily found in green leafy vegetables, such as collard greens, kale, and spinach. K2, menaquione, is produced by bacteria in the human body from eating animal-based and fermented foods. Vitamin K3, menadione, is a synthetic form of K1 formulated for animal feed and vitamin supplements. Vitamin K1 is the only supplement form available on the US market. What are vitamin K's major biological functions? 1. It assists in blood clotting, acting as a coenzyme for the carboxylation of certain blood clotting factors. 2. It helps strengthen bones through the carboxylation of bone formation related proteins. And 3. Acts as a cofactor in several key roles in the human body.
Some of the top vitamin K rich foods include leafy greens, including kale, 472 micrograms per raw cup, Swiss chard, 299 micrograms per raw cup, collard greens, 184 micrograms per raw cup, and another type of vitamin K rich food can include oils, which is seen in the chart on the right, vegetables, oils, and daily needs. Some oils can include canola oil, 3.2 micrograms per teaspoon, and margarine, which is 3.9 micrograms per teaspoon. The DRI values for vitamin K. DRI is also known as dietary reference intake, which is the reference value that is a quantitative estimate of a nutrition intake. It is also used to plan and assess diet for healthy people. So on the chart that says table 1, the adequate intake for male and female is the same until you reach the age 19 plus years. And the difference is that the male gets 120 micrograms versus the female that gets 90 micrograms.
So some examples of foods that are really rich in vitamin K are a cup of spinach, which is 145 micrograms, 4.3 cups of blueberries, which is 120 micrograms, half a cup of broccoli, 3/4 of a cup of pomegranate juice, and 1 ounce of dry roasted cashews, and half a cup of soybeans. So some way to incorporate this into your diet, if you're a male, it could be 1 cup of spinach with 4 cups of blueberries and 1.5 cup of broccoli with 1 ounce cashews. There's a lot of mix and matches. Female could be half a cup of broccoli and 1 cup of soybeans. So there's a lot of different ways that you can incorporate this into your diet, and it just depends on what you really like. The tolerable upper intake level for adults, we found that the Food and Nutrition Board did not really establish ULs for vitamin K, specifically 1 and 2, because of its low potential for toxicity. In its report, that the Food and Nutrition Board stated that no adverse effects associated with vitamin K consumption from food or supplements have been reported in humans or animals. However, overconsumption of any supplement can lead to toxicity. Vitamin K3, which I'll talk about more in the next slide, is a synthetic form of vitamin K, which can lead to toxicity if taken too much, as it can interact with additional medications an individual is taking. So the 3 most common reasons for toxicity, again, vitamin K3, high levels of that. It's also known as menadione, is toxic to humans. It has no functional use in humans. Toxicity may be from its water-soluble properties. Taking vitamin K with other drugs, they may interfere with the effects of vitamin K. So ask your healthcare provider before taking vitamin K with other drugs. And these can include antacids, blood thinners, antibiotics, aspirin, and medications for cancer, seizures, high cholesterol, and other conditions. So patients are advised to eat a healthy, balanced diet with leafy green vegetables and fermented foods where vitamin K1 and 2 are naturally found, respectively, instead of supplementing it with the vitamin K supplements. But still, patients are advised to not take more vitamin K than needed for their age and condition.
Right, so the top 3 effects of toxicity in the body, one is jaundice or the yellowing of skin and eyes. Then there's hyperbilirubinemia, the anemia, which is the buildup of bilirubin in the blood. Bilirubin is a byproduct of the breakdown of red blood cells, and high levels circulating in the blood can be indicative of some sort of liver disorder. There's also hemolytic anemia, which is a disorder where red blood cells are destroyed faster than they are produced. Then on the flip side, the three more common reasons for deficiency are simply a lack of vitamin K in the diet, and this could be from low or consumption, or high doses of vitamin A and E, which decrease the absorption of vitamin K. There's also fat malabsorption and disorders that can impair fat absorption, and this is important because vitamin K is fat soluble, and so a lack of fat makes it harder for our bodies to absorb it. There are also certain drugs like anti-seizure drugs, antibiotics, and anti-clotting drugs like warfarin that impair absorption in their own way. The top three effects of deficiency in the body are osteoporosis, coronary heart disease, and vitamin K deficiency bleeding, which is mainly seen in infants. Osteoporosis is characterized by fragile bones, and vitamin K does play an important role in maintaining bone health. Vitamin K is also important in reducing the risk of coronary heart disease. One of the main proteins that reduces this risk by reducing calcification is vitamin K dependent.
So vitamin K can have some interactions with different vitamins, minerals, compounds, foods, and medications. Here are two medications that vitamin K interact with. One of them is warfarin, which is a blood thinner, which is also known as an anticoagulant. And basically what this does is this drug acts as an antagonist for vitamin K. Other anticoagulants, blood thinners, can have the same type of dangerous interaction with vitamin K. So it's not recommended to consume vitamin K while on blood thinners. Antibiotics that kill bacteria in the gut produce vitamin K, so it can decrease the body's levels of the vitamin as well. And bile acid sequestrants reduce the absorbance of vitamin K. Another drug here is orlistat, which is a weight loss aid, and these basically reduce the fat soluble vitamins, mostly vitamin K. So here's some more fun facts about vitamin K. The history of this vitamin dates back to research of Carl Peter Henrique at the Biochemical Institute of the University of Copenhagen. He found this from 1928 to 1930, and he discovered it as a part of experiments on sterile metabolism. Some more fun facts is vitamin K is found throughout the body, the liver, the brain, heart, pancreas, and bones, and it rarely reaches toxic levels, even with high intakes, because it's so broken down very quickly in urine and stool. Antibiotic medicine can also destroy vitamin K producing bacteria in the gut, and vitamin K is fat soluble. So the best way to eat vitamin K is with some fat to improve absorption.